The numbers of older people who are frail are rising, and increasingly, as those people become frailer, their chances of going into hospital, getting stuck there, have also gone up. So more than ever, organisations need to work together to try to prevent that from happening.
There are two issues with the number of older people being admitted to hospital. The first one is an increasing demand as the population ages, which is having a real impact on the capacity of the hospitals to deal with it. And secondly then is the quality of care that is provided to older people, which is likely to go down as a consequence if we're not very careful.
The 100 Days Rapid Results project was about getting multidisciplinary professionals who don't normally work together, but are actually all involved in the care of the frail patients to work together to see if they can't redesign the system and come up with suggestions and improvements. And that's what they've done.
It's all about giving permission to professionals at the front line to work with people who directly use public services to solve problems in real time.
Within the community, particularly around frailty and unplanned admission, we've tended to have GPs doing admission avoidance. We've had our agenda of frailty, and they're very similar in nature. So what we were actually able to achieve was kind of bringing those together.
We're bringing in people from other sectors that perhaps we wouldn't have before, like the voluntary sector, like our community agents, our social workers, psychiatric nurses.
We've got practitioners and people from every service that affects the life of a frail person.
So instead of becoming very doctor-centred, they're now a much more truly multidisciplinary team, and that's really exciting. That's so much better than it ever used to be.
We now have a mental health nurse that goes to 3 of the GP surgeries to attend the Frailty meetings.
This is about deciding who's the best person to help somebody, rather than us all just sort of working in silos. It's about working together for the benefit of the patient. And if a patient doesn't need to go to hospital, then they don't go.
An IM form is a patient-held form, and it stands for Information About Me. It's a form that the patient is given to fill out, and it very much asks what's important to the patient. This really gives patients the initiative of bringing up issues that they have to us.
My name is Christine Hardy and I live in Chelmsford. I have asthma, type 2 diabetes, gout and primary lymphedema. I think that's enough to be going on with.
Christine went into hospital. It was an acute admission because of a pneumonia and what we call an acute kidney injury. Hi Christine, how are you?
Yeah, I'm all right, a bit breathless.
Whilst she was in hospital, we were undertaking the 100-day challenge. So when she was discharged at the end of March, the community matron went in to see her, I visited her, our district nurses went in to see her. Unfortunately, 2 weeks later, Christine became unwell again and potentially was at risk of going back into hospital with another chest infection. But with the team approach we had, we actually managed to maintain her and treat her at home. And I think it was a real team effort that we achieved that.
When I came out of hospital, I had a lot of people visiting and they all communicated with each other. So if I had a particular problem, then they passed it on, everybody knew. So I was very lucky because I was being very well cared for, and it's continued since then.
I think it's really important that patients have an opportunity to talk about what they want, what sort of care they want, what's important to them, and us to respect that.
The IAMS form is full of information about myself, how many illnesses I've got, what medication I'm on, and it gives me a single point of contact, which almost like a safety blanket. Dr. Towers asked me to fill it in, or asked if I would like to fill one in. It's not compulsory. It's important that my care is about me, so I need to be involved along with everybody else. So as long as we're all in the loop, works fine.
We measure the success of the project by looking at the numbers of people who have gone into hospital on an unplanned basis. The numbers, the early numbers from the project, look very positive indeed. It looks as if we've had a significant impact on reducing the numbers of people going into hospital, but we need to do further work to make sure we understand that those figures are accurate and we understand what that means in terms of savings, for example.
What we've seen so far from the way that the individuals have designed the systems differently is actually a very positive impact already from patient feedback, although the statistical numbers are too small to prove anything just yet.
One of the benefits which isn't always seen is the building of relationships, and one of the outcomes of this project, what we have seen, is that relationships have started to build in a very different way, much more positive way, people getting a better understanding of what individuals, professionals do in contributing towards better outcomes for people with frailties.
When you talk to professionals, you go out and meet with them, you get a feeling that there's an awful lot more energy in the system. People are working together, the relationships have been developed, there's now direct telephone conversations rather than referrals going off and having to wait several weeks to get a conversation going. So you know, that's a huge benefit.
This collaborative and networking approach for frail people makes my life so much easier, because I now have a great deal of resources that I know about that I can call on at short notice for short-term and long-term conditions, and also helping planning care for people, particularly the frail, the elderly and the vulnerable.
I'm very excited about what we can do with this. I think it really could turn into something very special, and I think Essex, Mid-Essex especially, could be the design for the future of the NHS in England.